I was called attention seeking. At 6 years old, I was called a drug seeker. There was a whole lot of things that people thought because I wasn't diagnosed, so it was hard not knowing what was wrong. I always had bruises all over me, so Mum was investigated for child abuse. I was in a stroller until I was 7, so people thought that Mum was being a little bit stupid letting me be in a stroller until then, but if I'd walk, I'd be in pain for days, or I just couldn't walk, like I'd just sit down on the floor and not be able to walk. I was bullied a lot because before I was diagnosed I had a knee brace, and that obviously made me look different, so people sort of pick on the person that's different. Part of me always hoped that we would find out that there was something wrong. It's sort of strange that I'd get a medical test and hope that they'd find something, not because I wanted to be sick, because I wanted there to be an answer. When I was 9, Mum took me to our normal GP and said, I can't do this anymore, she's sick, people don't believe me. So he said that he'd send me to one of the people he went to university with, who was a paediatric rheumatologist, but he didn't think that anything would come out of it. So I walked into Dr. Murray's rooms and he asked me to come close to him, and I did, and he felt my skin and he said, I can tell you exactly what's wrong with you. You have Ehlers-Danlos syndrome, because the collagen in the skin makes it very velvety and smooth. Mum was really happy, and then we went home and she Googled it. It was the worst thing she could have possibly done, because things like organ rupture and short lifespan and all of that came up. So she had to make another appointment to go and see what it actually was. I do a lot of talks about Ehlers-Danlos syndrome to different organisations and schools. In the beginning, they aren't too interested to hear about an illness that they don't have or know nothing about. But by the end of it, they're usually interested and ask questions and that sort of thing. When I was in high school, there was a boy that was bullying me, and I wrote a letter to him and I asked my headmaster if I could give it to him, and the headmaster said, no, we'll give it to the whole school and let them read it. So we did, and then after that the letter went worldwide, so I was sort of asked to do more speaking events, and it sort of come from there. I have a Facebook page that I update about my health and that sort of thing. I enjoy scrapbooking, cooking and those sort of things. I've made up cards that say what Ehlers-Danlos syndrome is, and when I go into hospital I make up packs that have a brochure and what EDS is and that sort of thing, so that they understand some part of it before treating me. I've made a lot of friends with the same illness online, and I don't think I ever would have got into public speaking if it wasn't for my illness. So there's been good things that have come out of it. After a few years, Mum was told that she should sign me up with Therapy Focus, so we did. I was the first Ehlers-Danlos patient that they'd had, so they weren't too sure what would help me. So we sort of fought for the right bracing and that sort of thing. They got the bathroom redone for disability and the granny flat. Some days I do need to use a wheelchair in here, so it helps that it's all wheelchair accessible and that sort of thing. They just got me an electric wheelchair because my shoulders dislocate when propelling the wheelchair, so that way I can use the wheelchair independently. The sooner that you get things like braces and splints and physiotherapy and those sort of things, the better outcome you'll have, and you can slow down the progression a little bit. You can't stop it and make them better, but you can help to slow it down. I think I'd tell them to keep fighting for a diagnosis and that they should believe their child even if people say that they're imagining it and all of those sort of things. And I think that you have to fight for the right treatment and that sort of thing, and stay up to date on treatments once you've got a diagnosis, so join support groups and that sort of thing.